The skin, a window to our health. Our skin is the largest organ in our body, serving as a protective barrier against the outside world. It plays a crucial role in regulating temperature, sensing our environment, and even contributes to our immune system. However, skin health is about more than just a flawless appearance. It often reflects what's happening inside our bodies, signaling potential imbalances and underlying health conditions. Dermatological conditions, ranging from acne and eczema to psoriasis and rosacea, are incredibly common, affecting millions worldwide. These conditions can cause discomfort, impact self-esteem, and even point to more complex internal issues. Both Western medicine and traditional Chinese medicine recognize the importance of skin health, but they approach it from different perspectives. Bridging Western and Eastern approaches. While Western medicine and traditional Chinese medicine may appear distinct, they can be powerful allies in the pursuit of optimal skin health. Integrating these two approaches, combining the strengths of Western pathophysiology with the holistic wisdom of traditional Chinese medicine, offers a comprehensive and potentially more effective way to manage and treat dermatological conditions. This presentation delves into common dermatological conditions, exploring both their Western medical explanations and their interpretations within the framework of traditional Chinese medicine. We will examine the Western pathophysiology of each condition, outlining the biological mechanisms involved. We will then explore how traditional Chinese medicine views these conditions, identifying common patterns of disharmony that contribute to their development. Importantly, we will also delve into the scientific evidence supporting the use of traditional Chinese medicine therapies, such as acupuncture and herbal medicine, in treating these conditions. By bridging the gap between Western and Eastern approaches to dermatology, we aim to provide a more comprehensive understanding of skin health and showcase the potential of integrative medicine in achieving lasting relief and promoting overall well-being. Understanding the enemy. Western perspectives on acne. Acne vulgaris, commonly known as acne, is a prevalent skin condition affecting individuals of all ages. It targets the pilosebaceous unit, consisting of hair follicles and sebaceous glands. Western medicine attributes acne to four main factors. Hyperkeratinization clogs hair follicles. Sebum overproduction fuels bacterial growth. Bacteria thrive in clogged pores, causing inflammation. The immune response leads to redness and swelling. This can result in visible acne and scarring. Acne through the lens of traditional Chinese medicine imbalances and disharmonies. While Western medicine focuses on the biological mechanisms of acne, traditional Chinese medicine takes a broader approach, viewing the skin condition as a reflection of internal imbalances. Rather than solely targeting the symptoms, traditional Chinese medicine seeks to address the root cause, aiming to restore harmony and balance within the body. Traditional Chinese medicine identifies several patterns of disharmony that can manifest as acne. One of the most common is heat in the lungs and stomach. This pattern often presents as red, inflamed acne, frequently concentrated around the nose, cheeks, or forehead. It can be aggravated by spicy foods, alcohol consumption, or emotional stress. Another prevalent pattern is damp heat in the spleen, characterized by oily skin accompanied by pustules or cysts. This pattern often stems from poor dietary choices, such as consuming excessive greasy, sugary, or processed foods, which can disrupt the spleen's function of transforming and transporting fluids in the body. Lastly, blood stagnation is often associated with chronic cystic acne that proves resistant to conventional treatments. This pattern presents as painful, deep-seated nodules, often leaving behind scars. Emotional stress, trauma, or long-standing imbalances can contribute to blood stagnation. The Science of Harmony, TCM Solutions for Acne. Recognizing these patterns of disharmony allows TCM practitioners to develop personalized treatment plans that address the individual's unique constitution and imbalances. Acupuncture and herbal medicine are two cornerstones of TCM, both supported by a growing body of scientific evidence for their efficacy in treating acne. Acupuncture, a practice deeply rooted in TCM principles, involves the insertion of fine needles into specific points along energy pathways, known as meridians. These meridians are believed to regulate the flow of qi and blood throughout the body. By stimulating these points, acupuncture aims to reduce inflammation, regulate sebum production, and restore balance to the body's systems. Herbal medicine, another integral aspect of TCM, utilizes the therapeutic properties of plants and minerals to address various health concerns, including acne. TCM herbalists carefully select and combine herbs into personalized formulas tailored to the individual's specific pattern of disharmony. For instance, Jinyan Hua, or honeysuckle flower, and Huang Lian, or Coptis rhizome, are two herbs commonly employed for their anti-inflammatory and antimicrobial properties. These herbs can help to reduce redness, swelling, and bacterial growth associated with acne. Decoding the itch. A Western perspective on eczema. Eczema, or atopic dermatitis, is a chronic inflammatory skin condition affecting millions worldwide, often starting in childhood. Characterized by intense itching, redness, and dry patches, eczema impacts quality of life, causing sleep disturbances and emotional distress. Western medicine sees eczema as a complex disorder involving genetic predisposition and environmental triggers. Immune dysregulation causes the body to overreact to harmless substances, triggering inflammation within the skin. Eczema in the mirror of TCM, unraveling the internal landscape. While Western medicine focuses on the biological mechanisms of eczema, TCM offers a different lens through which to view this chronic skin condition. TCM recognizes the interconnectedness of the body's systems and views eczema as a manifestation of internal imbalances that disrupt the flow of qi and blood, leading to disharmony within the body. One common TCM pattern associated with eczema is wind heat or wind damp, characterized by red, itchy, and dry skin that may weep fluid. This pattern often arises from external triggers, such as allergens, irritants, or even weather changes. Wind, in the TCM context, represents the swift and unpredictable nature of the condition, while heat signifies the inflammation and redness present. Another prevalent pattern, particularly in children, is damp heat in the liver and gallbladder. This pattern presents as persistent, inflamed, and weeping lesions, often accompanied by digestive symptoms such as gas, bloating, or constipation. Dampness in TCM refers to a buildup of fluids, while heat represents inflammation. Chronic cases of eczema, where the skin becomes thickened, dry, and flaky, are often attributed to blood deficiency in TCM. This pattern suggests an underlying deficiency in nourishing yin fluids, leading to dryness and impaired skin regeneration. Section 3. Restoring harmony, soothing the skin. TCM approaches to eczema. TCM's holistic approach to eczema extends to its treatment strategies, which aim to restore balance and harmony within the body, addressing both the root cause and the symptoms of this persistent skin condition. Acupuncture and herbal medicine, two cornerstones of TCM, offer promising avenues for managing eczema and alleviating the discomfort it brings. Acupuncture, with its ability to modulate the body's energy systems, has shown potential in reducing inflammation, relieving itching, and improving skin barrier function in individuals with eczema. By stimulating specific acupuncture points along meridians, practitioners aim to regulate the flow of qi and blood, calming the immune response and promoting healing. Herbal medicine, another integral aspect of TCM, harnesses the therapeutic properties of plants to address the underlying imbalances contributing to eczema. Herbal formulas are carefully crafted, combining different herbs to target specific patterns of disharmony. For instance, Shengdi Huang, known for its nourishing and cooling properties, is often incorporated into formulas for eczema associated with blood deficiency. Dang Gui, another commonly used herb, possesses anti-inflammatory and blood-circulating properties, making it beneficial for patterns involving damp heat or blood stagnation. Section 1. Beneath the surface. A Western perspective on psoriasis. Psoriasis is a chronic inflammatory skin condition that impacts both physical and emotional well-being. Western medicine views psoriasis as an autoimmune disorder, where the immune system mistakenly targets skin cells. This leads to hyperproliferation of keratinocytes, causing rapid skin cell turnover. The result is thick, scaly plaques on the skin's surface, Inflammatory signals, particularly cytokines, drive this process. Genetics play a significant role, with family history being a strong risk factor. Section 2, Psoriasis through the TCM lens. Deciphering the body's messages. TCM views psoriasis not merely as a skin-deep ailment, but as a reflection of deeper imbalances within the body's intricate web of energy, organ systems, and emotions. Rather than focusing solely on suppressing symptoms, TCM seeks to understand the root cause, addressing the underlying disharmony that manifests as this persistent skin condition. One common TCM pattern associated with psoriasis is blood heat. This pattern often manifests as acute flare-ups characterized by bright red plaques, accompanied by intense itching and burning sensations. Heat, in the TCM context, doesn't necessarily equate to physical temperature, but rather signifies an overactive inflammatory state within the body. Stress, spicy foods, and excessive alcohol consumption can further aggravate this blood heat pattern. In contrast, blood dryness often underlies chronic cases of psoriasis, where thick, dry, and flaky scales take center stage. This pattern suggests an underlying deficiency in nourishing yin fluids, essential for maintaining the skin's moisture, suppleness, and regenerative capacity. Another pattern often implicated in psoriasis is damp heat. This pattern presents as moist red lesions that may ooze or weep, often accompanied by itching and discomfort. Dietary factors, particularly the consumption of greasy, sugary, or processed foods, can contribute to damp heat accumulation, further exacerbating psoriatic symptoms. Seeking harmony, finding relief. TCM strategies for psoriasis. Guided by the principles of restoring balance and harmony within the body, traditional Chinese medicine offers a range of therapeutic approaches to manage psoriasis, addressing both its physical and emotional aspects. Acupuncture and herbal medicine, cornerstones of TCM, have garnered increasing attention for their potential in providing relief and improving quality of life for individuals living with this chronic skin condition. Acupuncture, with its roots firmly planted in TCM principles, aims to regulate the flow of qi and blood throughout the body, promoting healing and restoring balance. By stimulating specific acupuncture points along meridians, practitioners can influence the immune system, reduce inflammation, and alleviate the itching and discomfort associated with psoriasis. Herbal medicine, another integral aspect of TCM, harnesses the therapeutic properties of plants to address the underlying imbalances contributing to psoriasis. Herbal formulas are carefully crafted, combining different herbs to create synergistic effects tailored to the individual's specific pattern of disharmony. For instance, zikao, or lithospermum, renowned for its cooling and blood-clearing properties, has shown promise in reducing inflammation and slowing down the rapid skin cell turnover characteristic of psoriasis. Its ability to modulate immune responses and reduce the production of inflammatory cytokines makes it a valuable herb in managing this complex skin condition. Beneath the blush, a Western perspective on rosacea. Rosacea, a chronic inflammatory skin condition primarily affecting the face, often begins with a whisper, a fleeting blush, a tendency to flush easily, a subtle redness that comes and goes. Yet, over time, this whisper can escalate into a persistent redness, visible blood vessels, and even inflammatory bumps and pustules. Western medicine points to immune responses, vascular dysregulation, and microbial influences. Rosacea centers on small blood vessels, leading to their dilation and increased visibility. Cathelicidin, an antimicrobial peptide, is found in higher levels in individuals with rosacea, contributing to inflammation and blood vessel dilation, fueling the characteristic redness of rosacea. Rosacea. Through the TCM lens, unveiling the heat within. Rosacea, with its tendency to paint the face with shades of red and its association with flushing and inflammatory bumps, finds a familiar echo in the principles of traditional Chinese medicine. Rather than viewing rosacea solely as a skin condition, TCM delves deeper, recognizing it as a manifestation of internal imbalances, particularly those involving heat. One of the most common TCM patterns associated with rosacea is heat in the lungs. This pattern often presents as redness and pustules concentrated on the nose and cheeks, mimicking the classic butterfly rash often seen in rosacea. Spicy foods, alcohol consumption, and emotional stress can further fan the flames of this internal heat, exacerbating symptoms. Another prevalent pattern, particularly in individuals prone to flushing and emotional reactivity, is liver fire. This pattern, often triggered by stress, anger, or frustration, manifests as facial flushing, rapid heartbeat, and even irritability. The liver in TCM is responsible for the smooth flow of qi, and when liver fire flares, it disrupts this harmony, leading to the characteristic symptoms of rosacea. For individuals experiencing persistent pustules and inflammation, TCM often identifies a pattern of damp heat. This pattern, often stemming from digestive imbalances, involves a combination of heat and dampness, leading to stagnation and inflammation in the skin. Dietary factors such as excessive consumption of greasy, sugary, or dairy products can contribute to damp heat accumulation, further aggravating rosacea symptoms. Section 3. Cooling the flames. TCM approaches to rosacea. TCM's approach to rosacea centers around restoring balance and harmony within the body, addressing both the internal imbalances and the external manifestations of this chronic skin condition. Acupuncture and herbal medicine, cornerstones of TCM, offer gentle yet powerful tools for cooling the flames of inflammation, calming the skin, and restoring a sense of well-being. Acupuncture, with its ability to modulate the body's energy systems, has shown promise in reducing facial redness, calming inflammation, and promoting a more balanced complexion in individuals with rosacea. By stimulating specific acupuncture points along meridians, practitioners aim to regulate the flow of qi and blood, reducing heat and restoring harmony to the body's internal landscape. Herbal medicine, another integral aspect of TCM, harnesses the therapeutic properties of plants to address the underlying imbalances contributing to rosacea. Herbal formulas are carefully crafted, combining different herbs to create synergistic effects tailored to the individual's specific pattern of disharmony. For instance, guangqin, or Scutellaria bicalensis, renowned for its potent anti-inflammatory and heat-clearing properties, is often incorporated into formulas for rosacea associated with heat patterns. Its ability to reduce redness, soothe the skin, and modulate the immune response makes it a valuable herb in managing this often stubborn skin condition. Section 1. The elusive itch. A Western perspective on urticaria. Urticaria, or hives, is a skin condition that appears and vanishes quickly, leaving itchy welts. It involves mast cells in the skin reacting to perceived threats. Western medicine links urticaria to histamine release from these cells. Histamine causes blood vessels to dilate and become more permeable. This leads to fluid leakage, forming red raised welts called wheals. Triggers include allergens, autoimmune processes, and physical stimuli like heat or cold. Urticaria, with its swift onset, transient nature, and often puzzling triggers, finds a fitting analogy in the TCM concept of wind. Just as a gust of wind can appear suddenly, disrupt the environment, and then vanish without a trace, so too can urticaria manifest with similar unpredictability. TCM, in its pursuit of understanding the root cause of imbalances, views urticaria as a manifestation of disharmony within the body's intricate web of energy, organ systems, and external influences. Rather than focusing solely on suppressing the itchy welts, TCM seeks to address the underlying triggers and restore balance to prevent future occurrences. One common TCM pattern associated with urticaria is wind heat or wind cold. This pattern, often triggered by exposure to external pathogens, such as viruses or bacteria or sudden changes in weather, manifests as itchy, raised welts that appear suddenly and may be accompanied by other symptoms like fever, chills, or headache. Chronic or recurring urticaria, particularly cases accompanied by digestive symptoms like bloating, gas, or loose stools, often points to damp heat in TCM. This pattern suggests an accumulation of dampness, often stemming from dietary factors like excessive consumption of greasy, sugary, or dairy products, combined with heat, which can manifest as inflammation and itching. TCM's approach to urticaria centers around calming the internal storm, addressing the underlying imbalances that contribute to this unpredictable skin condition, Acupuncture and herbal medicine, cornerstones of TCM, offer gentle yet effective tools for alleviating the discomfort of urticaria while addressing its root causes. Acupuncture, with its ability to modulate the body's energy systems, has shown promise in reducing the frequency, severity, and duration of urticaria outbreaks. By stimulating specific acupuncture points along meridians, practitioners aim to regulate the flow of qi and blood, calming the immune response, reducing inflammation, and restoring balance to the body's internal environment. Herbal medicine, another integral aspect of TCM, harnesses the therapeutic properties of plants to address the specific patterns of disharmony contributing to urticaria. Herbal formulas are carefully crafted, combining different herbs to create synergistic effects, targeting both the symptoms and the underlying imbalances. For instance, fang feng, known for its ability to dispel wind and alleviate itching, is often incorporated into formulas for urticaria, particularly cases associated with wind cold or wind heat patterns. Its ability to reduce histamine release and calm the skin makes it a valuable herb in managing the unpredictable nature of this condition. Chinese medicine, though often perceived as mysterious, follows a logical and systematic approach. By understanding that external symptoms reflect internal imbalances, we can interpret the body's signals. For example, red skin indicates heat, purple skin suggests blood stagnation, and pus or oozing points to dampness. Chinese medicine focuses on identifying the precise combination of imbalances, such as organs being too hot, cold, dry, or damp. The goal is to restore proper balance of energy and fluids, as well as improve communication between interconnected organ systems. This internal harmony is then reflected externally as clear, healthy skin. As we've journeyed through the landscape of common dermatological conditions, exploring both their Western medical explanations and their interpretations through the lens of traditional Chinese medicine, a powerful theme emerges: the potential for synergy between these seemingly distinct approaches. Western medicine, with its emphasis on identifying specific mechanisms and developing targeted treatments, provides valuable insights into the biological underpinnings of skin disorders. TCM, on the other hand, reminds us that our skin is not an isolated entity, but rather an integral part of a complex, interconnected system. It encourages us to look beyond the surface, delving into the internal imbalances, energy disruptions, and emotional factors that can contribute to skin disease. By acknowledging the strengths of both approaches, we open the door to a more comprehensive and potentially more effective way to manage and treat these often stubborn conditions. Acupuncture, a cornerstone of TCM, has garnered increasing scientific support for its ability to modulate the immune system, reduce inflammation, and promote healing. Studies exploring its efficacy in conditions like acne, eczema, psoriasis, and urticaria offer promising results, suggesting that stimulating specific points along energy pathways can influence physiological processes, even at a cellular level. This growing body of evidence bridges the gap between ancient wisdom and modern science, highlighting the potential of integrative approaches to healthcare. Herbal medicine, another integral aspect of TCM, further expands the therapeutic toolbox, offering a gentle yet powerful way to address the underlying imbalances contributing to skin disorders. Plants, with their complex chemical constituents and long history of medicinal use, provide a rich source of therapeutic potential. TCM herbalists, drawing upon centuries of knowledge, carefully select and combine herbs into personalized formulas, tailored to the individual's unique constitution and pattern of disharmony. Scientific research into the efficacy of specific herbs and herbal formulations for dermatological conditions is ongoing, with promising results emerging for herbs like huangqin, zitao, and fang feng, among others. The growing interest in integrative healthcare reflects a broader shift in healthcare perspectives, acknowledging the limitations of solely focusing on symptoms, while recognizing the importance of addressing the root cause of disease. By embracing a holistic vision of skin health, one that considers both the internal and external factors at play, we empower ourselves to make informed choices about our well-being. This integrative approach encourages open communication between healthcare providers from various disciplines, creating a collaborative environment where patients benefit from a tapestry of knowledge and expertise. Ultimately, the goal is not to replace one system with another, but to create a harmonious blend, drawing upon the strengths of both Western medicine and TCM to pave the way for lasting relief, improved quality of life, and a radiant, healthy glow that reflects not just clear skin, but a balanced body and mind. Michael Woodworth has over 20 years of clinical experience and over a decade of postgraduate advanced herbal and acupuncture training. He has been helping patients young and old with a wide spectrum of skin conditions and offers his expertise in San Diego, California at Makari Wellness.